record on this. There we
go. Okay, next slide. So I'm Lily Caravello. I'm a program administrator with the Mendocino County Social Services Department, the Special Projects team, and on the Outreach and Navigation Unit. Veronica, you want to go?
And I'm Veronica Wilson. I also am a program administrator on the Special Projects team. I oversee the Housing Coordination Unit that kind of supports and oversees the continuum of care and, homeless grants and contracts and things like that.
Great, thank you. These presentations, these sessions are designed to give you as much information about the topic in a short amount of time. So we ask that you keep yourself muted right now. We're going to have each presenter tell us about their program and what they offer around housing vouchers and subsidies. And then at the end of all the presentations, if we have time, we'll open it up for questions. Otherwise, you can feel free to put them in the chat. And if we can't get to them during the presentation, then we'll try to get back to you later on. If you were forwarded the invite to this meeting and want to receive any materials from this session or emails, invites to further sessions, then please email me or Veronica, and we'll put our information in the chat as well so that you could get to us. Okay, Veronica, next slide. I might have already gone through the other stuff. So these sessions are designed for staff that work with the community who are trying to navigate through the housing system. Each session is focusing on a specific topic. We, in previous sessions, have focused on things like housing navigation and other housing resources. And in the future, we will have some sessions focused on transitional housing and low-income housing as well. Next slide. So today, our presenters are going to be Teresa from the CDC, Paul from Hospitality Center, Priest from Northern Circle, Zoe from Social Services. Veronica is going to present on a couple social services programs. And then I think we're going to have Jen from Redwood Community Services.
It may be Sage. We may call
or maybe Sage. Right. That's right. We were quite sure. Yeah. Okay, next slide. Oh, okay, so we're going to get started. We're going to get right into it. Do we have Teresa here?
Yes, I'm here. Hello.
Wonderful. Okay.
All right. Well, I gotta go first.
Thank you. Yeah.
So first, thank you, Lily, for having me here and us being able to talk a little bit about our programs. My name is Teresa DeSimone, and I work for CDC. CDC is Mendocino County's Public Housing Authority. And on this slide, you'll see our address, where our business is located, and also our contact information, including our website. Next slide. Okay, what is provided? So CDC, we really offer a diverse variety of rental assistance programs. There are different programs for low-income individuals, for families, for elderly, for people who are unhoused, for veterans, and for persons with disabilities. A rental subsidy is provided to households, which allows for a more sustainable, self-sufficient, safe, and decent living environment. Participants pay a portion of the monthly rent, which is dependent on their household's income, and CDC provides a housing subsidy for the remaining portion of rent. We administer rental assistance to approximately 1,250 households in Mendocino County. And in collaboration with the COC, the local homeless service providers, our landlord liaison, we were able to house 85 homeless individuals or households in 2023 with rental assistance. Next slide. Who is eligible and how do they apply? So we administer many different rental assistance programs, and each one is unique to the community's needs. I think we have a total of 11 different programs. So I think that's where it sometimes kind of gets complicated. Our biggest program, the one that we're most known for, is the Housing Choice Voucher Program. On this program, we have approximately 1,000 households who are housed with rental assistance in Mendocino County. And when this waiting list is open, this program is open and available to low-income individuals and households. So when the waiting list opens for this program, usually this is what you want to make sure that your clients get on to this waiting list. So how do you apply? The waiting list is currently closed. We're fully utilizing our voucher program. We've housed as many households as possible with the funding that we were awarded. Our intention is to open this waiting list towards the end of 2024. When the list is open, your client would need to complete an application and submit that application to CDC during the opening and closing dates of the waiting list. Next slide. We also have the Veterans Affairs Supportive Housing Program, which is the VASH program. The VASH program is designed for homeless veterans receiving case management and/or clinical services, which are provided by the VA. So CDC provides rental assistance to approximately 60 VASH households. How do you go about applying? The local VA screens homeless veterans for this program. Eligible homeless veterans are referred from the VA clinic directly to CDC. Once CDC receives the referral from the VA, we'll process the application for income eligibility. And if eligible, we'll issue that household or individual a voucher, and they can start searching for a unit in Mendocino County. So a good contact would be the VA if you know of a homeless veteran who is willing to get case management services, and the VA contact information is listed there. Next slide. We have a program called Family Unification, or otherwise known as the FUP program. And it's designed for low-income families in which Mendocino County's Public Child Welfare Agency has determined the lack of adequate housing as a factor in removing a child from the home or allowing that child to return to the home. We also have youth vouchers under this program for 18-year-old to 24-year-old individuals who left foster care and are homeless or at risk of becoming homeless. We have 20 family unification vouchers. How do you apply? Mendocino County Family and Children's Services determines if the household meets the eligibility criteria for this program. And if they were determined eligible, Family and Children's Services submits a referral directly to CDC. Once we get that referral, the family is placed on the waiting list. Once they're pulled, we determine eligibility and then issue them a voucher to search for housing. Next slide. We have also the Permanent Supportive Housing Program, otherwise known as the PSH program. The PSH program is a collaborative program between CDC and Mendocino County homeless service providers. This program provides rental assistance to approximately 136 households in Mendocino County. Oh, let's go back to the PSH slide. There we go. And it is designed to help chronically homeless individuals with a disability and their families. How do people apply for this one? CDC selects clients for the PSH program directly from the coordinated entry system. If your client is chronically homeless with a disability, it is important to make sure they have had a coordinated entry assessment in order to be considered for this program. If you do not have access to the coordinated entry system, make sure to refer your client to a front door access point for an assessment. And we have those listed on the last slide. Next slide. Project-based vouchers, or the PBV program, It's a little bit different than a normal voucher that somebody is issued a voucher and they go out into the community and find their own housing. The project-based voucher rental assistance program is offered by CDC. It's for specific developments that are located within Mendocino County. A rental subsidy is attached to an identified unit and is provided to individuals and families when they lease a unit at that development. So CDC has 140 agency-owned project-based voucher units located throughout Mendocino County. We also have project-based voucher units located at Ore Creek Commons in Ukiah, Sun House in Ukiah, the Plateau in Fort Bragg, and Walnut Apartments in Fort Bragg. And how you apply is different depending on the location of the development. So for CDC's, a project-based voucher cannot be used for mobile home space rent. I just saw that question, so I answered it. A normal voucher can, though. For our agency-owned PBV units, again, we own about 140 project-based voucher units located throughout Mendocino County. These units are available to low-income individuals and households, and the waiting list for these units is open now. Applications can be obtained at our front office or on our website at cdchousing.org. And somebody would complete that application and submit it to CDC, and then they can be placed on the waiting list. Next slide. For project-based voucher units at the Plateau, we have 20 one-bedroom and two-bedroom project-based voucher units located within the Plateau development. These units are designed specifically for low-income homeless individuals and households, and CDC selects applicants directly from the coordinated entry system. So again, if your client is homeless, it's really important to make sure that they have a coordinated entry assessment in order to be considered for these units. We have 25 project-based voucher units located at Walnut Apartments in Fort Bragg. These consist of 1, 2, and 3-bedroom apartments. This project is available to low-income individuals and households, but the waiting list for Walnut Apartments is currently closed for the PBV units. Next slide. Sun House PBV units. These units are designed for senior veterans who receive supportive services from the VA. Eligible households are identified by the VA, and when a unit becomes available, the local VA will submit a referral directly to CDC. For Ore Creek Commons in Ukiah, we have 20 one-bedroom and two-bedroom project-based voucher units located within the Ore Creek development. These units are designed for low-income individuals and families who are receiving specific services from Redwood Community Services or Health and Human Services. RCS and Health and Human Services identify eligible households and provide the household with a verification letter. With this verification letter, the household can submit an application for these project-based voucher units directly to CDC. Next slide. How do we guide clients to your program? So our website is a good resource. It lists any open waiting list that CDC has available and also includes information on who is eligible and how a person can go about applying for the program. So if you're working with a homeless individual, again, make sure they have a coordinated entry assessment. And we realize it's complicated. We have many different rental assistance programs, and they all kind of have their own eligibility criteria, but we're always here to help. So you can always contact CDC directly at the front office, and we can answer any questions that you have. We also, whenever we we've been getting a lot better about this recently, but whenever we open one of our waiting lists, we make sure that we send out notification to COC partner agencies. So look for those announcements and make sure you're aware of the opening and closing dates of those waiting lists.
And if you aren't a current COC partner, you can send me an email and I'll add you to our list. And if you want to become involved, I can explain more about that.
Yeah, thanks, Veronica. Absolutely. Okay, next slide. How can we help manage clients' expectations when referring to your program? So one thing, it's really important that clients know they are applying for a waiting list. CDC does not have any emergency or quick housing options available. How fast CDC gets through our waiting list is dependent on our funding from HUD. So what is the process? Number one, the first thing, apply for rental assistance when the waiting list is open. If our waiting lists are open, applications can be found on our website or located outside of our front office doors. Number two, wait until your name reaches the top of the list. Once your client applies, they will remain on the waiting list. We notify applicants by mail. Make sure your client gives a good mailing address. If their mailing address changes, make sure they know to always update that address with CDC. Number three, program eligibility. Once your client's name reaches the top of the waiting list, we will send the applicant notification by mail. The notification will include a list of documents the applicant must submit in order for CDC to determine if they're eligible for the program. Once they're determined eligible, we're going to do a voucher briefing. Your client will need to attend a briefing appointment where they will be issued a voucher to search for housing in Mendocino County. If they applied for a project-based voucher unit and CDC determines they are eligible, their application will be referred directly to the development's property manager. Next slide. How do we reach your program for further questions? Again, you can contact our public service representatives, or you can email us at info@cdchousing.org. And again, our website has a lot of information on it as well. Next slide. And these are the front door coordinated entry access points. And I just want to, I'm not sure, Northern Circle is the newest one, and I'm not sure they're quite ready to do coordinated entry. Maybe Veronica or Priest could update on that. But Ukiah Building Bridges, people can go there to get a coordinated entry assessment. I would probably recommend calling. I'm not sure if they have specific hours to do that. And then Fort Bragg, the Mendocino Coast Hospitality Center is also a front door coordinated entry access point. And if not now, Northern Circle Indian Housing Authority will soon hopefully become a front door coordinated entry access point. So that is it. That's what I've got for CDC. And again, I'm available. I think my email is there. If you have any questions, you can absolutely call or email me.
Thanks so much, Teresa. That was a lot of great information.
It's a lot of information.
That's good. Thank you.
I have a question. Can I ask it now?
We're going to hold questions so we can get all the speakers in.
Okay.
So if you could put it in the chat, or we'll try to get it to
I'll
it at
try
the
and
end.
go through the chat and answer some questions.
Great. Thanks, Teresa. Okay, I think we're going to have Hospitality Center next. All right, do we have Paul here? There he is. Thanks for joining us again, Paul.
Yeah, thanks for having me. I'm Paul Davis. I'm with the Mendocino Coast Hospitality Center in Fort Bragg. And we provide a variety of services to folks. And in previous sessions here, we talked about our housing navigation and case management, and that is that's all part of our housing subsidy programs. So what we provide here at the center for clients is we are one of the front doors for coordinated entry. So that means that folks can be referred here or walk in and they can get into the coordinated entry system here with one of our staff. We're available for walk-ins and appointments to do that, and that's usually the first step that folks are going to need to do in order to get the other types of support that we offer. We do have a rapid rehousing program here. We are currently in between contracts, but we expect to have that resource available here pretty soon. Rapid rehousing is a fairly flexible housing subsidy program. We can help folks pay for move-in costs, which might include deposits, first month's rent. In some cases, folks need some help with getting their utilities set up too. So we're able to do that and then provide some ongoing rental support if needed. We use the lightest touch possible methodology for that, but yeah. And then we are also a CalAIM community supports provider. We do that through Partnership Health, community supports. What we do here is a housing navigation and other housing support program where we can provide you some case management. Our housing navigator is the main person that deals with folks. And community supports comes with a one-time up to $5,000 stipend for housing deposits, and we have gotten them to be fairly flexible on that with move-in costs, but they call it move-in deposits, and that's the main thing. And we've been able to help 3 or 4 clients so far in the last several months utilize that to get into their own place. In addition to that, we do referrals, and we are the liaison for some other community resources. One of those would be the county's Flex Fund program. So we can help you apply for that. We can help answer questions if the county has any questions for folks and kind of get you through that process. And we also make referrals to Front Door for Families. And with anything that's not here internally, if we're not providing the cash or whatever, we're always here to be a liaison if you need us to be, or help communicate with those outside programs so that you can get that help for yourself. As far as the voucher programs are concerned, we keep up on all of the available vouchers to our clients. Everything that Teresa mentioned, we will typically, if there's a wait list opening or some other type of availability for something, we make sure that we have those notices posted here. Our housing navigator keeps up with all of the openings, and then we help our clients to apply for those, verify eligibility, and we do a lot of communication with CDC on behalf of our clients if they need help. Some folks want to have notices and stuff addressed directly to us so that we can make sure that it gets to them. Some of our folks aren't great at picking up their mail or getting their mail, so that's sort of our role in the voucher process.
Okay, thanks, Paul.
Sure.
Thank you so much for giving us that information. And just a reminder to everyone, we will have this recording posted on our COC website and the PowerPoint presentations posted as well. Okay, next up, we've got Priest. There you are.
Good morning, everybody.
Welcome.
I'm really glad that this is the type of resources we need for everybody in our community. I've been waiting forever for us to meet. So with that being said, Northern Circle is the entity of 9 tribes. That doesn't mean that we don't support other entities or tribal members of the community. But when it comes to on-site rentals for the low-income units, in Mendocino County, we have Giddyville, Hopland, Manchester Point Arena, Redder Valley, and Sherwood. If you have tribal members that are needing assistance from those tribes, please refer them to us. Their support that they get is we have units on Rancherias, and we also support with rental assistance for tribal members for that. All right. With that being said, that's just for the on-site with the tribes that we have. What we also have is that super important is that, for the individuals that need our services is we have Credit Builders Alliance that we try to build people's credit. It's hard to move into places when you don't have credit and you have bad credit from your past. So we provide trainings and webinars for the Credit Builders Alliance, and we also partner with the Consumer Financial Protection Bureau. What we do is we provide the services that we need to make sure that people that are homeless get the best support with the reference letter and also with the certificate that says that they completed the training. And also what we can do is we have Rent Plus. What Rent Plus is, if they are already receiving rental, they're paying rent, we try to build their credit that way. I'm not sure if other organizations do, but I think it's a law in California. I think it's the best thing we could ever do for helping people that rent from us in our community. All right, so that's just a small portion of what we do here. The bigger portion is that we do HDAP. What HDAP is Housing Disability Advocacy Program. And if you are homeless and if you feel that you have a disability, we try to provide that support and do support rental assistance, pay their bills, try to get them in the process of lease, starting the disability program. And what that is we help them for 6 months and we reevaluate after that. We take care of rears under HDAP, and we also take care of past bills. Preventing being homeless is our biggest thing. For bringing families homes, you have to have a open CPS case or a ICWA case or a previous case or potential case. We're working with Lily and their team over there to try to do referrals. That one's kind of more sensitive in the community, but it doesn't mean that we can't support in any way possible. And we also have Home Safe. If we have elders out there that are 61 and over and on disability and they are being mistreated, that's what Home Safe's for. If you are a disabled 18-year-old to 60 and you're being mistreated, that's what Home Safe is for. We try to prevent homelessness for individuals. It's not just for tribal members, it's also for community members. You just got to, the only qualification is be a California resident, or he can't be out of state. What else we have is we do home repairs over here for people up to a certain amount of funding. What we also do is that we provide the individual, just like Paul was saying, we do the same thing with Cal AIM. We are also a provider that does the housing navigation, plus 6 other deliverables under that, but we won't go active on that until the 1st of April. And then for the front door, I think me and Veronica and I think it's the lady that did the first presentation.
Risa.
Lisa. So we could do what that is for Northern Circle to have that available. The most important thing that I think that we get out of this is that I share these resources with you guys. If you look under the Northern Circle Indian Housing, nciha.org, and then you'll be able to get a hold of me and see the services that we provide. I think we're going to provide more broader spectrum of support in community, because what is needed is that we have way too much people that are out there suffering. And I say this over and over everywhere I go. If we don't listen to them, then we're not be able to provide the services. And that's all I got to say today. I think it's a great thing. If you guys could send me your resources, we need to have that central place where we have the information and we all have like that links to each other. And then we could be able to help a lot more. Like I said, I'm open to having meetings with other organizations. My team is all hired, ready to do this, and being a part of the COC is super important. Thank you.
Thanks so much, Priest. And could you put your contact information into the chat so that others who want to connect with you can get
Okay,
there?
will
That'd be
do.
great. Hey, doing great on time today. Next up, we're gonna have Zoe.
Hi, can you hear me okay?
Yep, sounds great. Thanks, Zoe.
I'm Zoe Fernandez. I'm with the Special Projects team here at the Department of Social Services. And I'm going to talk about the Housing Needs Flex Fund that some of you may be familiar with. Next slide. So the Flex Fund it provides assistance to both individuals and families who are either homeless or at risk of homelessness. We try and do eviction prevention if we can, or house people who are currently homeless. It is designed to be the funder of last resort. So if there's another method for an individual or family to receive assistance, we do ask that you use that method first. And if that doesn't work, then we can sometimes catch those people who need assistance. Next slide. So most of the time, what we most commonly fund is security deposits and first month's rent for families or individuals who are either couch surfing or literally homeless. And we also do people who have been housed and they have fallen behind on their rent for some reason. We are able to pay back rent if it prevents eviction. If somebody is going to be evicted anyway, we can't pay in that case. We're only doing it to prevent eviction so that they can maintain their housing. Sometimes we are able to do more than 1 month of rental assistance. And because we have a variety of funding sources, it depends on the situation and the case. This is only available for families with children because of our funding sources. If it's just an individual, we can't do any ongoing rental assistance. But with families, we are able to do a couple months depending on the situation. And sometimes we will pay half of their rent and they will pay the other half. We look at each situation on a case-by-case basis. And it's not always as simple as we would like, but we do try to meet the needs of these families so that they're able to maintain their housing. Next slide. So our program is designed that our partner agencies submit applications on behalf of the clients. We don't accept applications from clients directly. We ask that they go through one of our partner agencies. That way, we know a little more about the situation and what's going on. We found that works best. And our application and the instructions are on the COC website. There's a tab that says resources, and if you click on that, and I think it's on the last slide as well, it says Housing Flex Fund, and you can access it that way. Next slide. So you are always welcome to email me, and my email is on the directions there on the website. If you have any questions about a particular situation and you want to know if it might be funded or not, and I could check with Megan, or sometimes I know, depending on what it is. Because it is you've got to get a few documents together in order for an application to be approved. There's the application, and then we pretty much always nowadays need a W-9 unless it's a rental application. That we can usually get away with not having a W-9. But other than that, our fiscal agents usually request a W-9. We need a lease agreement. If it's a new rental, we definitely need a lease agreement, or we're doing ongoing rental assistance. And a ledger if it's eviction prevention. And what I didn't put on here is the eviction. Oh, I did put the eviction notice. We're required to have an eviction notice if somebody's going to be evicted. They can't just say, oh, I'm behind on my rent. They have to actually have that 3-day notice, which most landlords will produce for them if they know we're going to be paying. And then we need the HMIS forms for each member of the household, which because we put this program in HMIS. And there is also a verification of housing status, which is one form that you would fill out for the family or the individual. So funding is not guaranteed. We try and reiterate that. We do not want people to move into an apartment assuming they will receive assistance until it has been approved by Megan or Lily, because there's a lot of considerations, and we don't want landlords to have that expectation. We also don't want clients to have that expectation. So each application is evaluated on a case-by-case basis, and depending on the check amount and where we're requesting it from and the funding source, it's not quick. It can take up to 3 weeks sometimes for a check to be ready, because we get it, the county issues it, and they are not speedy when it comes to processing checks. So it's a lengthy process, and we are happy to contact, Megan or Lily can contact a landlord and let them know that the check is coming. And they've done that quite a bit, or send them an email or phone call to let them know that they've been approved and the check is coming, but that it will take a while. Landlords have been usually pretty receptive to that. Next slide. Oh, that's it. If you have any questions, you are welcome to email me, and I will help you in any way I can. If you don't want to submit an application, if you just have questions about it or a particular situation. And then I think on the next slide, Veronica, I think I had the COC website. Yes. The Flex Fund is there on the COC website.
And I also put the same link in the chat
Great, thank you. And that
and your email as well.
Perfect. Thank you so much.
Thanks, Zoe. Because we have a minute or so or extra time, and because I also work with this program, work with Zoe, I just wanted to reiterate that it is really important that this Flex Fund that you'll find on the COC website, the application needs to be completed by one of you, by an advocate at an agency. And that's because all we're doing is helping them with that little bit of funding, but they really, in order to be successful and continue to be housed, they need to be working with an advocate that's going to help guide them through the process to remain housed, to find other funding or other sustainability plans so that they can pay the next month's rent.
Yes, thank you. I did
yeah.
forget to mention the sustainability plan is really important. We don't want to move somebody into a place that they're not going to be able to afford. So on the application, there actually is questions about what is their sustainability plan, and maybe they're going to be working on it. Maybe they're going to be getting more hours, or they're going to have a roommate move in. And we want to know that. And the more information you can put on that application, the better, because that gives us a fuller picture of the client. It's helpful with knowing the situation.
Exactly. Yeah. Also reiterate that households and landlords should not count on the funding until they get the official approval. That you as an advocate may be helping them apply for the funding. You may hear from one of us, oh, yes, please submit this. This sounds like a great application, but that's not the official approval. That it really will take some time for us to review the flex fund request. And we have really complicated funding sources on the back end that we're trying to make less complicated on the front end for all of you guys and for the clients, but we're trying to find that right funding source to fit that specific household. And so we have to do a lot of review of it to make sure the funding meets the household. Okay, thanks, Zoe. And now, oh, there was a question about HMIS forms. The HMIS forms are on the website as well, and so those should be submitted along with the flex fund request.
Any HMIS forms that are completed with a client should be completed by whoever's with the client. There's reasons for that. And if you've never collected that, please contact me or Zoe, and we can get you that guidance, or maybe we can work on identifying somewhere else that can collect that data, like on a case-by-case basis, if you don't have HMIS experience.
Great.
And
Thanks,
I
Veronica.
represent the HMIS lead agency, so.
Yeah, and now we're
Yeah.
passing it back to you, Veronica, because our
Yes.
next presentation is about CalWORK's Housing Support Program. And the lead staff member on that program couldn't be here today, so Veronica's going to present for it.
And Lily, will you please keep an eye on the participants? There's been some folks that are
Popping in.
so it's
Yeah.
been pretty active, but I'll be
I'll keep
distracted.
an eye on it.
Excellent, thank you.
Yeah.
So hello. The CalWORK's Housing Support Program. I just that is the focus of what this presentation is today. It is implemented by the Mendocino County Department of Social Services, Employment and Family Assistance Services, or EFAS is what we call it. They are not physically located in the traditional social services building where Lily and I are at. They are at the Career Point site that is located on North State Street in Ukiah. There is also an office in Fort Bragg for the CalWORKs, but there's only one location that they do the housing support program. And the lead person for that, her name is Olivia Leo. And we can get her contact information to you before we finish here. So a lot of people hear about CalWORKs, and there's different components of it. And today's presentation is on a focus on one of them, but I want to explain the spectrum a little bit. And so CalWORKs is a state-funded, operated program for families with children. It's often whenever the parent is unemployed or underemployed. And it's a requirement of the TANF program. In order to accept cash aid, you have to go through employment training. And so that's what CalWORKs is aimed to do, to support people with. And so some people hear about the motel assistance, and that is actually offered by under the homeless assistance through CalWORKs, the CalWORKs Homeless Assistance Program. And so that's up to 16 nights in a hotel. There's some limited assistance beyond that. But that's really very temporary and targeted. And then there's also this program, the Housing Support Program, which is a rapid rehousing program. And so they will have openings that come up on their caseload. So, and they can start working by providing a bit of housing navigation services, case management assistance, a little bit of that, but it's mostly financial assistance to move into a unit with temporary rental assistance that reduces over time, over several months. And so that looks in the form of services that you see here. So the deposits and application fees, credit check, certain household items they're able to purchase. And then, like I said, the temporary rental assistance. And I know some people here have a little bit more experience with that. We even have one landlord represented that accepts it often. So if anybody has anything to add, please chime in. So who's eligible? Like I said, it's for those who are enrolled in CalWorks, so families with children who are underemployed or unemployed and are experiencing homelessness and have utilized the temporary homeless assistance. So they've used up that, 16 nights in a hotel. They, weren't able to find a place in that short window. And so they're going to need more long-term assistance. Also housing support program if they're pending eviction. So I would say they'd need to have at least a 30 or 60-day notice saying that they need to move out. So how do folks get referred to this program? It is through their eligibility specialist through CalWorks. And so you would oftentimes they'll get a notice of action or documentation from CalWorks, and their CalWorks eligibility specialist will be listed on that paperwork, and that's who would
That's
would
gonna
have
work on Sundays because
how can you guide clients to find this program? So again, that looking at that paperwork and finding out who that is and getting that contact. Got ahead of myself, didn't realize I covered it. How can you help manage clients' expectations when they are referred? Again, as you've heard here, just because a client is referred to the program doesn't mean that they're eligible or that the program has funding available to assist them. So a referral is not a guarantee of assistance. And so when a referral is received from a CalWorks eligibility specialist by the housing support program specialist, who's Olivia in the housing support program, Olivia will reach back to that customer either by phone or by mail to follow up on that referral. There is currently a waiting list for the program, but they're always accepting referrals. So and that wait list is determined based upon that worker's caseload and the funding that they have available to assist people with, because if there's no funding, there's not really much that they can do. And then here is the telephone number for the CalWorks Housing Support Program specialist. Her role is a program specialist for the Housing Support Program. And her telephone number is 707-467-5505.
Thanks, Veronica. That was great. It's a little difficult for us because these aren't our slides. So Veronica was trying to present for somebody else's program. And I just wanted to go through some of the steps because I know there's a little confusion. The CalWorks Housing Support Program is a little confusing on where it's located and how you get to it. That the very first step for clients, if they're looking for CalWorks housing support, is that they need to apply for CalWorks. And they can do that on the Benefits Cal online application, which allows you to apply for CalWorks as well as Medi-Cal and CalFresh at the same time. They have to do an application for CalWorks, and then they need to request temporary homeless assistance or indicate that they need housing assistance. And the referral comes from an eligibility worker here in our county welfare office. So not at the CalWorks Job Services site. It's you come into either your social services office in Ukiah at 747 South State Street, or in Fort Bragg, and you can apply and ask for housing assistance there. And then your eligibility specialist, who's the same one who would be talking with you about Medi-Cal and CalFresh, would then be doing that referral to CalWorks Housing Support. So contacting Olivia as a first step would not be the most direct way to do it. You have to first come into social services or apply online, and then you'll get the referral to Olivia at CalWorks Housing Support, and they can see if you're eligible. Okay, I just wanted to reiterate that part. Okay, our next presenter is, we're gonna have Sage. I did see Sage, there we go. Sage, are you able to present?
I will do my
Wonderful.
best.
Okay, thanks.
I will do my best. I wasn't super prepared. Jen was planning on being here, but is out sick today, so here I am.
Okay,
So I've presented before, and RC at Redwood Community Services has presented at previous things more about our Building Bridges Homeless Resource Center and emergency shelter, our housing navigation and case management services. So I won't go too deep into any of those things, but Redwood Community Services does a rapid rehousing program that is a combined supportive services with short-term rental and housing assistance. We target people experiencing literal homelessness. So we are really looking for those folks that are literally homeless, so staying in a place that's not meant for human habitation, and not necessarily those folks that have a history of chronic homelessness, so not those long-term homeless, unhoused folks, but people who have more of a need for that short-term assistance, who have, with rapid rehousing, we're really looking for folks who aren't going to need long-term assistance or have maybe another rental subsidy like housing choice voucher. Rapid rehousing can be a great pair to match with something like the housing choice voucher because they get some supportive services that help them get back on their feet. But with rapid rehousing, it is that short term. So we can get someone into the program. We do a housing barrier assessment and plan with each one of the participants, where we go over what are their barriers to housing, things like their income situation, their history of eviction, their criminal history, their credit history, things like that. And we look for ways that we can support them with reducing those barriers, with addressing, is there stuff that they can get expunged from their record? And then we will connect them with legal services and try to work towards that. Is there stuff on their credit history that they can pay off to help reduce that barrier to their housing? With rapid rehousing, the fund that we have to support the program is incredibly flexible. So we can use it for things like paying rental arrears. If someone has back payments of rent that they owe to a landlord, that would, if they paid that off, it would help clear their rental history, or it would help clear up some of their credit. So we can use it for that. If they have unpaid utility bills from the past, that is, once they get into housing, those unpaid utility bills are going to interfere with them being able to establish utilities at a new place. We can support with those sorts of things. And then once they do get into housing, so the rapid rehousing is a rental subsidy program. So we don't have physical housing projects that are secured for the rental subsidy. It is a, we work with the person to identify landlords and we can use our rapid rehousing funds to do short-term rental assistance, where we really can pay anywhere from 1 month or no months of rent if the tenant doesn't need assistance with rent, but maybe they just need help with the security deposit, or they need help with those arrears, but then they can pay the rent on their own. Or if they need any, like, short term, would be like a 3-month rental assistance where we're paying rent for 3 months while they get back on their feet and are able to take it on their own. Or we can do 6 months. We can do up to 2 years. We haven't had anybody that we've supported with rent for more than a year, mainly because the goal of the program is to get people back on their feet, help them figure out their long-term rental assistance, and then wean them off. So we will do a lot of work towards, like, either working with them to increase their own income or identify a longer term rental subsidy like housing choice voucher, or low income apartments that are subsidized that they can get into that will help assist them if they're not able to increase their own income. People, so it does come with that supportive services. So we have a team of housing navigators who are that team that's hyper focused on people's housing situation. And we pair our rapid rehousing program with our CalAIM community supports. So through community supports, if a person has Medi-Cal partnership, then we can leverage that resource to provide them with the housing navigation services. And then also with that, as Paul mentioned earlier, that housing deposit through Medi-Cal that can help support with things like security deposit or first month's rent. Paul, I want to pick your brain because it sounds like you're getting them to be more flexible with you than they are with me. So I'm curious what you're doing. So I might connect with you if I can, because it's been a little bit tricky for us to access that housing deposit resource through partnership. But how people access our rapid rehousing program is through the coordinated entry system. So if a person is experiencing homelessness, they really should be getting into the coordinated entry system. If you're a provider who is able to do the coordinated entry screening and enter them into HMIS yourself, I highly recommend doing that. If you're not able to do the coordinated entry assessment or screening and get them into HMIS yourself, we have front doors, and Building Bridges Homeless Resource Center in Ukiah is a front door. It is open to the public for screenings Monday through Friday from noon to 4. We could potentially do screenings outside of that, but really those are our main hours. And a person may come, if they come and don't get seen like right away, just because the staff have a gazillion things that they might be juggling at any given moment, it's worth it to them to like stick around and keep bugging us about getting that screening done. And then to stay enrolled in the coordinated entry system, people need to be re-screened every 3 months so that they stay current, so that we know that they're active. Because what we do when we have an opening in our rapid rehousing program, we go to the coordinated entry system and say, give us the highest risk, most vulnerable. Say we have one opening, we'll usually poll like 5 people for every one opening, because there is such a high rate of not being able to contact people, of not being able to find them. And so that thing where we do a rescreening for folks to keep them on the coordinated entry list, that's to make sure that when our housing providers like Rapid Rehousing or PSH go to connect with the folks, they're really still engaged in there. We're not going to be spinning our wheels with folks who haven't been seen in 6 months or a year, that we're looking at the folks who have been seen in the last 3 months. There's also, as Paul said, and they said earlier, that other coordinated entry front doors is Hospitality Center on the coast. But other organizations are definitely welcome to enter clients into coordinated entry. And I'm just going to put a pin here to go to contact Home Team. I think if you are an organization that wants to connect better with coordinated entry. I might like coordinated entry a little bit, so I try to sell it a little if I can. It is a great way to get your clients connected with housing resources.
Thanks,
Sorry
Sage.
if that was a little rambling. I was winging it.
No,
Okay,
I thought that
thanks.
was great. I got a lot of information out of it. Thank you, Sage. And I think those are all our presentations. We have 2 minutes. So if there are some questions that haven't been answered, well, we still have a couple minutes. Feel free to unmute and ask your question.
Hi, Lily. I am wondering about just kind of the flow, like how frequently there's an opening available for rapid rehousing.
Is this to Sage, maybe? Okay.
So for our rapid rehousing program, we currently are working with about 15 households, and are looking to pull another 8 or so in the next week or so. So what openings we have, because it's a flexible project, it can be a little bit tricky for us to say like exactly when we'll have another opening, because we could have a household that uses large chunk of funds for housing to get back on their feet. And if we have a few of those, we're not going to have an opening until because of the bucket of money. We have one bucket of money. And if we use that bucket of money for rental assistance for 5 households, because they all need a lot of help, then we're going to have less openings. But if we are working with households that just need a little bit of help, we're going to have openings for more households. And so it's hard for us to predict exactly how many openings or how many at any given time, how many clients we can hold. Whereas like there might be other rental subsidy programs are more kind of mapped out as far as like, okay, I have a client, I know that they are going to need permanent supportive housing and rental assistance. It's a 1-person household, so they're likely to need this dollar amount for a period of time, so it's easier to map it out. So I'm not great at answering the like how many openings are we likely to have question, because it is a very flexible pot of money that really is very tailored to each household's needs.
Yeah. And there are other rapid rehousing providers in the county, so others are pulling from the list as well. We're at time. So I want to make sure that we stay on time, let everyone go. Just know that we've recorded this. We'll be posting it on the COC website, and send me an email if you didn't receive the invite. And I really appreciate you guys joining. Thanks.